Hello, everyone that's listening. As you know me, I'm Dr. Spree, and today we have a special guest, Faith Schoenecker. And oftentimes in our professions, I get asked all these different questions about, where's your favorite place to go out to eat, but also the serious stuff like, what do I do about my kids here, or is this a normal part of development? And now that we're getting back into the back to school week, a big focus is my child on the right milestones. We did a video earlier today about how to pack school lunches, and we're going to talk about how to get back on sleep schedules. So in this case, because I wish I could say that I know everything, I absolutely do not. So in this case, Faith is going to lead us through really her specialty and some key points to look for and just help guide parents. And even if you think about yourself from time to time, am I hitting these milestones? Would you call them milestones?
Yeah, absolutely.
Am I hitting these milestones correctly? Did they get missed? And what do I actually look for? So Faith is going to introduce herself and then really dive into where do we go from here?
Yeah. So I'm Faith Schoenecker. I own Root Speech Therapy, and I see kids in schools and in home, and I have a lot of experience working in the clinic setting as well as in school. So often when I introduce myself as a speech language pathologist, parents usually have memories of either being in speech themselves when they were in school or knowing somebody who was in speech class when they were in school. But really, I work across the lifespan.
Yeah, absolutely. And thank you for being here today, and thank you for being a part of this and guiding us into this direction. And your focus today is what's normal for speech development.
Yeah.
And so, what exactly are we looking for here?
Yeah. So like I said, when I mentioned I'm a speech language pathologist, I work across the lifespan. So not just the kids in school who get taken out of class to work on a specific speech sound. I work with kids and young adults all across the lifespan to improve anything that has to do with the mouth, jaws, or the face. So slushy speech sounds like R's, S's, and sounds like those are really the specialty and really the focus of what we're going to talk about today, because that's a common question that I get.
Slushy, I like that word.
Yeah.
It puts perspective on what you're talking about.
Yeah. So one thing that I get a lot of questions about is what's normal for speech development, and that's what we'll dive into today. But I also work on infant feeding skills like tongue tie, pre and post care for that, any issues related to the jaws like TMJ pain, and then treating feeding disorders, which we just put together a really cool video about feeding tips for the school year. So those are the main areas that I focus on. But today we're going to talk about treating speech sound disorders, especially with the school age child.
Yeah, I just have to say, even though this isn't our topic today, is my daughter had Isabel, who many of you met, had a tongue tie and had a lot of trouble just getting onto solid foods. Mm-hmm. And your help was tremendous with that. It really just made the transition so much easier for us. So I'm really excited for your insight.
Yeah, so it seems like the second that we think we've got it all under control and mastered, our kids do something new and we have to try to keep up with them. So even just within the span of the first year of life, so much changes for little mouths, from infant feeding in bottles and breastfeeding all the way to being primarily on solid food. So yeah, the first year is kind of a roller coaster.
Absolutely.
Yeah. So for speech sound disorders, it's really any kind of consistent error with one sound or a group of sounds that's inappropriate for their age. So kids usually learn speech sounds naturally through their environment, but sometimes children need to be taught how to produce specific speech sounds. So that's where I come in, is we identify where some sounds are inappropriate for the given age, and then we tackle it. And so while most kids learn it on their own at their own rate, sometimes we do have to jump in and help.
Absolutely. And I don't really have much to add to this. Yeah. It's just those different sounds to listen for and what seems normal and what doesn't.
Yeah. So I just put together a couple sounds that are the most common in the school age child. So when I say school age, I'm talking about kindergarten and up. That's the R, the S, and the Z, and I paired them together, and the TH sound, like So we'll tackle each of those at a time. The R, it surprisingly has 32 different variations. So that means we're gonna have just an R at the beginning of a word, like if we're saying run or rabbit. That's one variation of it. But some kids will have a hard time with another variation of it, like in the word tire or airplane. So depending on where in the word the sound is will change how it's produced and really what the tongue has to do to produce it. So some people are like, oh, they just don't have their R. So when we say, well, they just don't have their R, that's fine, but it can include up to 32 different movements of the mouth.
Wow.
So
That's fascinating.
it kind of is. So anyway, so you have them listed out here. So air, ear, or ire, or an R. So and then that could be at the beginning, middle, and the end of the word. A lot of parents, if you're watching this, you probably have an awareness of, oh yeah, that's my kid. Or if they have their R, it hasn't even crossed your mind. The S's and the Z's is one combination of sound that I think of is really common with school age elementary school kids, and that's often with a lisp or too much airflow. So kids produce their S's and Z's between their teeth like this. That is pretty consistent with a lot of the kids I see in school. And later on in our video, we're going to talk about when it's not normal anymore. One red flag that's not on here is when the S or the Z has a slushy sound out the side of the teeth like this. And that is never normal. So if you have a kiddo that's saying sun with all that airflow out the side, that is a red flag and really appropriate for intervention no matter what the age, even if they're like 3 or 4. So S's and Z's are a big one that I see a lot of, and then the TH. So if you have a little one that's saying thumb instead of thumb, that's a pretty common error, but at certain ages, it's no longer appropriate or normal, and that's what we'll get to.
And so you just had mentioned one thing that I haven't heard that much about before. When you're talking about too much, did you say too much airway or too much breath?
Yes.
What did you mean by that?
So too much airflow. So
Airflow.
all
Okay.
sounds are produced with
Excuse me.
airflow. No, it's a really good question. So airflow is how we get air from our lungs out through all the different mechanisms, the voice box, in through our jaws, and out to produce sound into words. Our mouths and our body is moving so fast when we're producing these sounds that airflow is fundamental, and it's the basic level for all of it. We have to have airflow, which is the air coming from our lungs out through our mouth.
We're working right now, and Mom's teaching everybody right in front of you.
We're making a video.
You can't see them yet, though.
All right, so those are the big ones. The one that I did leave off that I probably should have mentioned is the L. I see a lot of that. So I'll see a lot of kids who make a W instead of an L, like
Yellow?
like like yellow for yellow. That's a common error. Yeah. So here you'll see a whole bunch of letters, but this really means a lot to me when I'm seeing kids, or if I have parents asking me what's normal, is the early speech sounds, the middle speech sounds, and the late speech. You can have a little bit, that's fine. So the early speech sounds should be mastered by preschool. If you've got a preschooler, they should have all of these sounds that are in the first left box, the B, N, M, P, H, like the W, W, D, G, K. And then you're going to see this funny symbol that looks like an N, and that's the ing, like ring. And then the J really isn't a J, it's a y. So,
Interesting.
yeah, so these are written in it's called the International Phonetic Alphabet. So all the crazy looking letters, that's how I transcribe.
And if they want to hear these sounds again, is there
Yes.
a way they can look it up? Like, what keyword would they look for?
Yep. So if you search this key phrase on the top, normal sound acquisition. So the acquired Acquired age for each of these sounds should pop up as you do a Google search for normal sound acquisition, or you can always call a speech language pathologist and ask some questions. So really, those early speech sounds are almost never a concern. I hardly ever work on them in therapy unless something is pretty significantly off. The middle and the late speech sounds, or the middle and the far right, are the ones that are going to be more likely to be in error for your child.
So on your PowerPoint, it shows the middle speech sounds, and then you'd see right below it, that's what relates to the middle there.
Yep.
So each column has its own category.
Right. Yep. So between 4 and 5 years of age, we want to see these sounds start to be acquired and pretty much mastered. So like in the word very, and I put examples for all of these. The j for jump, s for sun, ch for chew, ball, so that L, wash, and zip. So one thing I pay a lot of attention to is that the SH, like sh, is different than the s. Even though they're spelled the same, you know, they both include an S letter, they would be considered different categories of sounds. And then the late speech sounds are acquired and mastered between 5 and 7 years of age. Those are on the far right, and those are the R in all positions, like tiger, the TH like this, and then the J like in garage, and then the TH like this. Oh, I did this twice. I meant to say that's twice. So it really should. So there's a th and a z, and so both of those tongue between the teeth sounds, they should pretty much all be mastered by 7.
So like the and this.
Yep.
Those
Exactly.
Okay.
Yep.
Thank you. Those are very helpful.
Yeah. So here we have a chart about intelligibility. And we're looking at how well your child is understood. This is a big thing when we start kindergarten and first grade, is we need our kids to be able to advocate and be well understood by everybody. If we've got a kid that's only understood by mom and dad, kindergarten is going to be really hard. We need those kids to be able to advocate for themselves.
Even just a night out, a babysitter. If no one knows what you're talking about, then
right.
Then you want more resources and your child to be understood by others.
Yeah, and so I'm sure most of us know that kid that's cute as a button, but you can't understand a thing that they say. So that's kind of one thing I get really passionate about, is that we want these kids to be understood in all settings by multiple people. So intelligibility is the ability to be understood. By 18 months, that's just about a year and a half, we expect kids to be understood 25% of the time. And I know there's no percentages on here, it's just a bar, but you kind of get the picture that by a year and a half, maybe you might catch 1 or 2 words.
Okay.
So the first word is at about a year, and then 18 months, you want to be able to catch a word here and there. That's about 25%. And that's totally normal. By 2, we want to understand about half, give or take. So 2 years old, understand half. By 3, we expect to understand 50% to 75% of your child's speech. And then here's the kicker. By about 4, we want to be able to understand 100% of what your child is saying. Now, this kind of counteracts with the previous slide where, well, I thought some of these kids were supposed to have all their sounds by 7. Isn't that different than 4? Yes, different. So we want kids to be understood. All the sounds are not going to be perfect. You might still hear rabbit for rabbit, but you still understand.
You know they're saying rabbit.
Yep, you know what they're saying. Yeah, the sounds are not going to be perfect at 4 and up, but you're looking for just being understood.
And then, do you think if parents have a child that isn't well understood by others, but is by them, is it obvious to parents or not really?
Not always. So I think especially when a family has one child or the oldest child has some speech issues, it's hard to compare it to anybody else. So often parents are not aware that there's a speech issue until they get to school, and maybe a teacher will mention something. But often you see that when parents have more than one child, they really notice the differences when the little sibling comes along and passes up the older one in speech skills. So Not always very obvious, but these are guidelines that I really go by when I talk to parents. So I think
Sorry about that.
a lot of parents have a good gut inclination when something is a little off, or when that awareness hits of, oh, you know what, I feel like something might be wrong with my child's speech, or grandma and grandpa can't understand anything that my child says. That is a concern, especially when we're getting to 3, 4, and 5, especially when they're going to school. So your school age child should be well understood 100% of the time. If not, it's time to seek out an evaluation from a speech language pathologist. You probably know that there are speech pathologists in every school.
I don't know that that's common knowledge unless you already have children in school.
I
that
suppose, yeah.
to know that the school really does have resources,
Mhm. Yep.
and that is an option.
Yep. So if you feel like your school ager might benefit from an evaluation at their school, you reach out to your teacher or the special education department and request an eval. So in Minnesota, we do have a law that really gets a lot of power to the parent. And anytime a parent seeks an evaluation through the school district, they have to do it. So
That's really nice.
Yep, and it is covered by the school. So
Okay.
if you have concerns and you're willing to go through the school district, definitely reach out to them. And it's a resource that we pay for that we should take advantage of as parents.
Now, one more question, Faith.
Yes.
I know I'm interrupting you quite a bit.
No, I love it.
But these are questions I get asked often: is do you wait until your child starts school?
That's a
for
good
this
question.
evaluation?
No, not always. So if you are concerned, you can definitely talk to your child's teacher and say, well, how is my child doing compared to their peers, if you've got a school age child, and then go from there and get a lot of information from your teacher. But if your child's not in school yet and you're feeling like, I feel like we need to be doing something before
Yeah.
school starts, you definitely can. So there's a lot of clinics that are private practice or hospital setting where you can benefit from a speech language pathologist help to get them on the right track before school. Some speech pathologists work in a clinic setting, some at a hospital, and some will even come to your child's daycare. So
that's
there's a lot of
really
options.
Just awesome to have a variety and not be stuck in one solid model too.
Yep. Or feel like you have to wait until school to get going on it. So that kind of leads into our next thought, is that when we work on these speech errors early, they can have loads of benefit as they get into the classroom. So literacy awareness is tied to those speech sounds. If we're looking at an S in a book, we're going to maybe confuse it with a TH. So if you've got a kid that's confusing an S for a TH, that's going to make their interactions with book just a slightly more complicated. Better eating skills. So you would think that I'm going to put better reading skills, but really better eating. The sooner that they can get in touch with a speech pathologist, they're developing more advanced control of their mouth, their tongue, and their jaws. So
fascinating how they're related.
Yeah, absolutely. So anything we do with the mouth is going to be strengthened by perfecting the skills.
Okay.
So we want our kids to be well understood. It's going to boost confidence if we can get them in and learning how to talk their very, very best. They're going to feel more confident.
Thank you.
Thank you very much. And then again, reading and spelling skills will be more successfully taught when they get to the classroom if they have a really good sound to letter awareness. So that sound to letter awareness is looking at a B and knowing that it goes buh. So if there's problems with that in elementary school, it can make the next phase of learning really complicated.
So the earlier is really the better option.
Yes. Long-winded answer, but yes, earlier the better.
Are there other ways besides the common way of reading a book that you can become more aware with the literacy awareness?
Yeah, so lots of ways. So
I hear you say things like sight words.
Yep, so sight words are words that we can anticipate kids are going to be exposed to when they get in the classroom. A lot of teachers will send out vocabulary word lists that can help you get a head start on exposure to those words early on, like the word I or do or go or my. Those really simple words that kids will have frequent exposures of over and over and over again.
I'm so sorry to interrupt. I took Izzy's magnets so she couldn't choke on them.
That's probably a good idea.
You want to skip that one?
No, it's good. The next suggestion from my perspective of having worked in the schools, worked in clinics, having some experience being in the hospital is if you feel like something is off with your child's speech or feeding or development in any area, don't wait for your healthcare provider like your pediatrician or your school teacher. Don't wait for somebody else to suggest getting the eval.
Would they even suggest it?
Sometimes, yes, of course.
Okay.
So sometimes parents will go to their well child visit at the yearly, 2-year, 3-year, 4-year checkup. And well, they didn't say anything about speech, so it must be fine. And that's not always true. So if your pediatrician or teacher is not suggesting an eval, that doesn't necessarily mean one isn't appropriate. Use your judgment and your gut inclination of what's best for your child to seek out an eval if you think it's right.
And you can always do a consultation too.
Yeah.
So if you're not sure, you're still the person, one of the people that someone could ask to say, is this the right path? Or
For
not?
sure. Yep.
I feel like you would be able to provide hands-on just from a conversation.
Absolutely.
Of knowing, is this a path that we should take and should we do an evaluation?
Absolutely. So I do free consultations over the phone if families have concerns and questions about if an eval is appropriate. I know I will take any phone call about these kind of questions and kind of guide you through the process of understanding if now is the right time for an eval or do we wait until later. Most of the time, if you're calling me, it means you've got kind of a question that you want figured out. So, but yeah, a lot of therapists will do free consultations, and myself is included. One other thing to note too about not always trusting your well child visit to be your guiding source is that your pediatrician has not taken advanced training in child language development. That's why we go see specialists. So, like for example, I would never trust my pediatrician to do a knee surgery for my child. But of course, I would trust their recommendation if they thought I should go see a surgeon. Okay, so your pediatrician is probably great, but they don't have advanced training in speech and language milestones in development. They know some, but it's not their specialty. So just
is a common misconception because healthcare has made a lot of changes over the last 40, 50 years, is that often we went to one family doctor for anything and everything. And not that that model was terrible.
Mm-hmm.
It's just that we've made so many advances now in our how would you say this? Like your knowledge and our expansion of what we know and what we can help with, that seeing multiple providers is not mean that your child has a ton of problems. It just means that you're finding the right people to help your child or help yourself in those
The specialty.
right positions.
Yeah, we
The
want
specialty is a positive thing that we'd like to emphasize on too.
Yeah.
Oh, excuse me.
So next up, I want to talk about some areas that are secondary red flags. So if you've already got kind of an inclination that your child is not on track for speech, these are some other things to look for that I see a lot of that can be an indication that therapy would be beneficial. Difficulty sleeping or poor kind of restless sleeping. Difficulty with nursing, difficulty taking a bottle as an infant, feeding issues or being picky, language concerns. So let's say your child, so what I mean by language concerns, and a lot of people think it's like, English or Spanish, but it's really not. It's more so about how kids are learning vocabulary and putting together sentences. So if there's concerns with how your child is communicating and expressing themselves, if they're only using a couple words at a time versus a full sentence, that would be what I imply with language concerns.
Okay.
And that can be a really loaded question because it's extremely complex. If your child has coordination or balance problems, cavities can be a sign of oral motor dysfunction. So history of cavities and early cavities is a big red flag. Drooling past the age of 1 or 2 is a sign of oral motor dysfunction. Difficulty learning letters, so that sound to letter awareness that we talked about before. So if we're constantly confusing B's and P's or constantly confusing Q's and P's past the age when it's normal, that can be a red flag.
And now, does this have anything to do with writing letters backwards, or dyslexia, or anything like that?
Yep.
That you would say, would you categorize that as difficulty learning letters as well?
Absolutely. So they often, a lot of these issues go hand in hand. They kind of work together. The other, you can take her. We're going to play with choice. Lastly, and really the list can go on and on, but these are the things I see most commonly is a past history of chronic ear infections. And whatever chronic means to you, ear infections that are an ongoing problem for babies and toddlers, they really play an impact on how kids learn sounds and learn to communicate.
In so many ways, not only the fact that they're getting ear infections, but also the treatment for it.
Yeah.
So being on antibiotics chronically,
Mm-hmm.
which in my definition would be more than once under 2 years of age, tubes in the ears, anything like that. These are outside of what the body is supposed to be doing. So these are red flags.
Yeah.
We had talked about previously.
Yep. Sign of a bigger problem. So one quick note about chronic ear infections that I'm sure that we see a lot of overlap between what we do is kids who have chronic ear infections often have an immature swallow pattern. So the middle ear, the tube that drains the ear into the back of our throat, is triggered open by a really good, productive, successful swallow using our tongue.
And you can think of this if you think, oh, I've been on an airplane and done a big yawn, and you feel like you pop it open. That's the inner ear portion we're talking about.
Yes, exactly. So often kids who I see who have ear infections or chronic issues with that eustachian tube during infancy, I'm usually working on feeding issues with them and trying to not reteach because they never had it. I'm trying to teach them a normal functional swallow to open up their inner ear.
And oftentimes, if this is not addressed, not as if this is not addressed, this will happen, but a possibility of things like sinus infections, upper respiratory issues, more difficulty sleeping later on, and prone to sickness, and then crazy things like headaches and anxiety, depression. All these things are related because of where they're located in the body.
Yep. And I know when you and I are kind of close to the same age, but when we were growing up, it was common practice to take out tonsils and adenoids.
Absolutely.
Now they're kind of scaling back and being a little bit more conservative with that procedure, but it is a big surgery, and just understanding why we're doing it and why the tonsils and adenoids are inflamed. So if you've got a kid that's always got huge kissing tonsils, if you're looking in the back of the throat, so we're kind of jumping ahead here into kind of different categories, but big tonsils and adenoids are a sign of a bigger problem that we want to look at. So, this of course is not an exhaustive list. It could go in so many different directions, but if you've got a school age kiddo that you feel like there is something more going on, speech and language is maybe not on the right track, give me a call. I have my contact information up here. I'm on Instagram quite a bit. Otherwise, my phone will always be available for a phone consultation where we can kind of do a brief case history about the what's what and help you decide if an evaluation is a good fit for you. If not, go the school route. See if your school is ready to do an evaluation.
Thank you so much.
Yeah.
And we have, if you're a person that's like, hey, I can't remember that, I don't have my phone on me today, whatever it is, we also have some of your cards in the office too.
Yeah.
We can give you those. So
I love it.
Thank you. You're just a wealth of knowledge. We love hearing from you. Thank you for being a part of this and giving us insight and helping us be raising healthy families and being the best parents we can.
My pleasure.
Your time today.
I love it. Thanks, guys. And I appreciate being here to share my information. And I look forward to hearing feedback and hearing if this has brought you any more clarity on any questions you might have had.
And so, very, very last thing is, I'm putting you on the spot, is how do you suggest this if you are a friend of someone that you're noticing this in someone else's kid?
Ooh, this
And
is
sorry,
a
I should have
big
brought this up
one.
earlier,
No,
but
it's
this
okay.
happens often is, what do I do if I know that child, but I'm not sure what to tell the parents?
That can be kind of dicey. So some parents, no offense against the dads, but some dads can take on this very protective barrier to not wanting to take any advice or acknowledge that anything could be wrong. So you really do have to sprinkle on some knowledge, some
and you don't want
yeah.
to feel like, if something's going on with your child, it doesn't mean you're a bad parent, but maybe if there's a question that you can open up into, or just passing off a referral card, this is something you can ask us in the office too. Like, hey, what do I say about this person? We can give you some tips to do so that you don't feel so forward, or
so you can suggest something like this without feeling like you're offending anybody, but just saying, I'm feeling like I have a hard time understanding so-and-so, this child, and have even just putting things kind of blunt. I think here in our area, we're a little too sensitive, to be honest. And just saying something like, have you ever considered getting them tested by a speech pathologist?
Yeah, I would love a question like that, because it wouldn't come to mind unless someone had suggested it.
Yeah.
So a simple suggestion sounds great. And
Yeah.
just, have you considered it? Do you know who to ask? You are an amazing resource. And the school is an awesome resource, and just having that introduction.
Yeah.
So thank you for letting me put you on the spot for that too. And thanks again, guys. We'll talk to you soon.